Hello guys, good evening everybody. In today's class, let us try to solve one question. It was one of the important questions which is asked in most of the competitive exams, and those were preparing CAPS, and if anybody is preparing GPAT or any other foreign exams, maybe this concept will be useful for you. So the question is, myopathy is an adverse effect of all the following except which drug? So here in the options they have given lovastatin, simvastatin, pravastatin. These three drugs are HMG-CoA inhibitors, and the fourth option is gemfibrozil. It is also a drug which is used in hypercholesteremia and cholesterol. All these drugs are used to decrease cholesterol in the body, and they are used in uh, obesity. Okay, so here from these options, lovastatin, simvastatin and pravastatin are HMG CoA inhibitors, and by that they decreases the cholesterol synthesis in the body. Okay, and gemfibrozil is one of the drug which is categorized under fibric acid derivative. Fibric acid derivative, it is a fibric acid derivative. Along with gemfibrozil we also have phenofibrate, okay, and clofibrate. So these are other examples which are very similar to gemfibrate. These are fibric acid derivatives. One thing you have to remember, all HMG CoA inhibitors, lovastatin, simvastatin, atorvastatin, pravastatin, rosuvastatin, all these drugs will cause myopathy. Myopathy. Remember this point. So myopathy is one of the muscle disorder. Usually, in most of the cases, some drugs will cause destruction of muscles, which is called myopathy, and with that it increases myoglobin concentration and creatinine kinase and creatinine in the blood, and with that it always myopathy is associated with rhabdomyolysis. Remember this point. Myopathy is always associated with rhabdomyolysis. Okay, rhabdomyolysis is the condition where urine is highly concentrated with most of the excretory waste products, which are usually caused due to myopathy. Okay, so remember, lovastatin, simvastatin and pravastatin are HMG CoA inhibitors, and these HMG CoA inhibitors will cause myopathy. Remember this point. And myopathy is always associated with rhabdomyolysis, and if anybody has excessive rhabdomyolysis, it can cause kidney injury. Remember this point. Okay, rhabdomyolysis जिस पेशेंट्स में ज़्यादा होता है तो उनको किडनी इंजरी होने के चांसेस ज़्यादा है. Okay, this is about HMG CoA inhibitors. And next option here what we have is gemfibrozil, which is a fibric acid derivative. Along with gemfibrozil we have phenofibrate and clofibrate. Even gemfibrozil also can cause myopathy. Actually, these gemfibrozil, phenofibric acid derivatives, when they are used alone, they may not cause myopathy, but when fibric acid derivatives are given along with other drugs, they can definitely cause myopathy. Other drugs means the drugs which can cause myopathy. Okay, so here in the options, gemfibrozil is also having probability of causing myopathy. And the next last option what we have is cholesterol. This cholesterol is also used for obesity to decrease the cholesterol level in the body. Actually, in hypercholesteremia and in those cases we use cholesterol. Cholesterol will come under bile acid sequestrant. Let me tell you, bile acid sequestrant. Actually, these drugs, what they do when they are taken through oral route, usually when those bile acid sequestrants are given through oral route in the GI tract and in the small intestines, these drugs will try to absorb the cholesterol which is coming from the liver. The cholesterol which is coming from the bile, that cholesterol is absorbed by this cholesterol or cholestyramine. We have another examples. Let me tell you first of all examples of bile acid sequestrants. Okay, examples of bile acid sequestrants in that cholesterol and cholestyramine. Actually these are huge molecules, These two drugs, what they do, they will try to absorb the bile acids which are coming from the GI tract. Bile acid contains lot of cholesterol, you know. Bile acid which is coming from the liver into the small intestine will have lot of cholesterol. That cholesterol is absorbed by these drugs, and what they'll do, they will try to decrease the reabsorption. They will decrease the reabsorption of those cholesterol from the small intestine, and with that it will try to excrete the excess cholesterol. Okay, actually अपने बॉडी में क्या होता है, usually in normal physiology, liver will produce bile, right? Liver produces bile. This bile will enter into the duodenum, and this bile contains lot of bile acids, bilirubin, cholesterol, and enzymes. Many other items are usually present in bile. So this cholesterol, what it does, it is useful for the absorption of other fatty acids in the small intestines, and from that this cholesterol which is present in the bile juice, it will again reabsorb back into the liver, and again in the liver that cholesterol is useful for making other cholesterol molecules, and it will be again useful for making bile. That bile will be releasing into this small intestine, again it will be reabsorbed, it will be released into the small intestine, it will be reabsorbed. This cycle is usually, it will be performing in the normal physiology. Okay, these bile acid sequestrants, what they'll do, they will try to absorb the cholesterol which is present in the bile acid, and with that it will try to excrete from feces. ये जो cycle होती रहती है, that cycle is stopped by bile acid sequestrants. That's why they will try to decrease the cholesterol concentration in the body. That's why they are used in obesity. Okay, so bile acid sequestrants are another examples of drugs which will decrease the cholesterol in the body. So let's go back into the question. Here already we discussed lovastatin, simvastatin, pravastatin, and gemfibrozil. All these drugs will cause myopathy, whereas bile acid sequestrants in that cholesterol will never cause myopathy. So the answer for this question is cholesterol. And let me add some more important points for myopathy. Already you know myopathy is the muscle disorder. Myopathy is not only caused by statins, just now we discussed, they are also caused by phenofibrates, okay, fibric acid derivatives. Myopathy is caused by statins, they are also caused by fibric acid derivatives, and there are some other very important drugs, very important drugs that can also cause myopathy. In that you have to remember amitin, you have to remember some antiviral drugs, antivirals. In antivirals, zidovudin, we have zidovudin, this one drug, and very important drug which will cause myopathy is corticosteroids. Corticosteroids, very important. Corticosteroids and some immunosuppressants. Immunosuppressants. In immunosuppressants, we have two very important drugs. One is cyclosporin, and other one is tacrolimus. These drugs are very important. Sometimes beta blockers. In beta blockers, we have labetalol. Labetalol also can cause myopathy, and sometimes propofol. Actually, this propofol is a anesthetic agent, parenteral anesthetic agent. So all these drugs, statins, fibric acid derivatives, corticosteroids, and in immunosuppressants, cyclosporin, tacrolimus, amitin, antivirals में zidovudin, you have to remember, and in anesthetics propofol, and in beta blockers labetalol. And one more important drug, actually in antibiotics we have fluoroquinolones. In fluoroquinolones we have ciprofloxacin, levofloxacin, ofloxacin. Those drugs actually they will cause tendinitis, but when fluoroquinolones are given along with statins, or when fluoroquinolones are given along with corticosteroids or immunosuppressants, they will aggravate myopathy. And always remember, combination of these drugs, statins and corticosteroids, should not be given, because statin is already causing myopathy, corticosteroid is already causing myopathy. When these two drugs are given in combination, myopathy will be increased. Same concept will be applied for all other drugs. Any two drugs which are causing myopathy should not be given in combination. You have to try to restrict that combinations. Okay, that is about myopathy and drugs which will cause myopathy. Okay, I hope you learned something from our video. If you learned something, please don't forget to subscribe and share this video to your friends. Thank you.